everyone, welcome to our channel. So a new topic which is in electrotherapy practical. So what is that? So question is material equipment testing and peripheral nerve stimulation. So what materials we can use for peripheral, like upper limb, lower limb, for nerve stimulation with different skeletal muscles. So which equipment will be used, different techniques, different gadgets, modalities, or different kind of skeletal muscles, or where we can apply the innervation or denervation will be nerve or muscle will be present. So how you write in university examination will be good marks. So first you can write introduction. What is that? So in electrotherapy involves application of electrical energy for therapeutic process such as pain relief, muscle stimulation, and nerve activation. The safe and effective use of electrotherapy devices depends on understanding the materials, equipments, testing, and principle of peripheral nerve stimulation. So it is basically for peripheries, upper limb or lower limb. For we can use different therapeutic gadgets to stimulate over their nerve to find it out effectiveness of contraction of muscle or like skeletal muscle is there or not. So we will depend on the machine. So materials used in electrotherapy. What is that? So electrodes are the interface between the electrotherapy devices and patient skin. So we can apply electrodes over the skeletal muscle to identify muscle is contraction or not. Types of electrode, like there is a types of electrode like metal plate electrode. So mode of stainless steel and aluminium and copper used with wet sponge pad. So there is a metal plate electrodes, and there is a copper, aluminum and copper is there, and in upper part there is a sponge and sponge pad over there for apply over this dermis and skin superficial layer, and like we can when the electrical current will be present, so there can be contraction will be find it out on their skeletal muscle. Next one is carbon rubber electrode. There is a flexible, reusable, and used with conductive gel and sponge pad. So there is a rubber electrodes, so we can apply the gel over there for identifying the muscle, skeletal muscle is contraction or not over there. So there is a biofeedback machine or like SD curve machine and electromyography machine, as you can study on previous videos or lecture. So there is a power generator, or there is a skin, there is a cable electrode or like adhesive electrode, and there is our upper limb. Apply the electrode with different part of the skeletal muscle like biceps, brachialis, flexor carpi ulnaris or pronator teres, flexor digitorum superficialis, flexor digitorum profundus, thenar muscle, hypothenar muscle. All of the muscle we can check over there nerve stimulation or nerve contraction will be present or not. Next pad is self-adhesive electrode. So it is a prepared for the gelatinous or like adhesive material over there. So pre-gelled or like disposable electrode used for convenience and hygiene. So if single patient for single self-adhesive electrode, only for that for their hygienist. Suction electrode used for interferential or like vacuum type of units, temporary fixation. There is a suction electrode you can apply over the skin, and they can suck the on muscle for their single muscle nerve stimulation to identify over there. Next one is the size and shape of electrode. Large electrode reduce current intensity and discomfort. Smaller electrodes increase current concentration and localized stimulation. If the pad is large, so the current density is high and the discomfort will be present. And if there is small electrode size is small, the current concentration is localized, and easily we can identify the contraction or like nerve stimulation is present or not. Care and maintenance. Clean after each use, replace when gel dries and surface become worn. Ensure when contact with the skin, avoid burn. So before the using any equipment into the skin and apply the electrodes on the skin, so must ensure about that. Use the gel on the skin for reduce the chance of the burning on the skin before the start of any electrotherapy treatment, or like checking the neuromuscular coordination or like function or like innervation, denervation, that kind of things. Second one is a conductive medium, so used to reduce skin resistance and improve current conduction. So conductive medium is like gel, you can apply over the gel, they can reduce the resistance and improve current conduction, like conductive gel, wet sponge, saline soak pad. So there is a like easily they can we can identify the current is came into our like on a machine or generator or like LCD screens. So there is a graph over there, so contraction will be present or not. Connective cables and leads. So what is that? So carry current from the machine to electrode must be insulated and free from cuts. Color coding help to identify polarity. So there is a two kinds of color code electrodes, black and red. Black is negative, red is positive. So it will be insulated, free from cut. There is no any kind of cuts present into the electrodes throughout also the coaxial cable or wire. Carry current from the machine or into the skin. There is no any kind of cut or like destruction of the any kind of wire is present. Next is patient accessories. So straps, bands to screw electrodes, towel for comfort, and insulation cleaning solution for skin preparation. So we can calibrate all of the equipment before the treatment plan, like different kind of pads, electrodes, machine, gel, or like different kind of other item, cotton, or like adhesive electrodes. Also like uh, tape for like not slippery of the skin, so that kind of things you can calibrate before the treatment plan. The equipment testing and maintenance, routine inspection. So before applying the skin, we can check the machine is like proper working or not. So first, routine inspection. In routine inspection, what is you can check? Visual check. You can see on your eyes, inspect the cable, electrodes, and plugs for damage. You can check the cable, electrodes, wire, all equipment is like good or not. Power supply, confirm the units turn into the properly. The power supply, the current will be cable to the machine and machine to the wire on the body, it will be good or not. Verify display and indicator function directly. So power supply you can check by the indicator on the apply on the skin directly. Control knob and switches, you can check the switch and knobs. So ensure intensity dials mode and selectors and time operate smoothly. Before applying any kind of electrode gadget into the patient, you can must ensure about the time it is appropriate to the patient or not. Check the connection to the skin, it is okay or not. Output test, connect the electrodes to the test circuit or dummy load. Check the current or voltage output using the multimeter. So you can show the screen applying on show the screen the graph. You can apply first on your screen and check the graph, it will be accurate or not. That after that you can apply on over the skin of the patient. Calibration, equipment must be periodically calibrated to ensure accuracy or parameter. Recommended for least 1 to year as per as manufacturer guidelines. So equipment जो है वो हम periodically कैलिब्रेट करेंगे, मतलब स्टेप बाय स्टेप फेजेस बाय फेजेस हम स्टेप कैलिब्रेट करेंगे ताकि next process में कोई problem ना आए. Must ensure about that for 1 year you can recheck or you can apply a new gadget, not a new machine. You can apply a cable or like a different kinds of electrodes for the patient for the accurate or good quality patient assessment. Electrical safety check, earth continuity test, leakage current test, and insulation resistance. So you can check the earthing, it will be good or not. Leakage of the current, it will be present or not, like any kind of cuts in their cable is good present or not. Insulation resistant test, there is an insulation is present or not on the machine. So commonly stimulated peripheral nerves, where we can check for the which nerves, which lesion, and which part of the bodies. So first we can check median nerve, it is a periphery which is present of the forearms. The wrist region, wrist and forearm you can apply, and for which muscle and which kind of action you can show that. So thumb opposition and which muscle it is will do, abductor pollicis brevis. Next is ulnar nerve. So which region you can check, wrist and elbow region. Little finger abduction, and what is there, which muscle is doing that, abductor digiti minimi. Next nerve is a peroneal nerve which is present in our leg, and for which region you can apply the current. So knee and fibular head. So for checking which kind of action, dorsiflexion, and which muscle will be perform that that action, it is tibialis anterior. Next muscle is gastrocnemius. What is their action? Plantar flexion. So which reason we can apply the cable or like a pad for electrical stimulation? Ankle region. And which nerve is doing performing the action? The tibial nerve. And also you can apply the facial nerve for checking and assessment the contraction is present or not, or like there is any kind of palsy or Bell's or facial palsy. So you can apply the near the ear region, or like zygomatic major or minor muscle for facial nerve, and facial nerve twitching we have shown that. So what is the parameter you have to show the difficult range. So set of the parameter on the machine. The call duration is to be 15 to 100 μs, the typical range. Frequency is to be 1 to 100 Hz. Intensity sufficient to elect desired sensory motor nerve. Different motor fibers have different kinds of suspense to electricity current. Treatment duration 10 to 30 minutes. And waveform monophasic and biphasic rectangular pulses. You can apply different kind of phases of electron for identify the contraction of the nerve or muscle over there. Why we are checking the nerve stimulation? What is the purpose? First is to assess nerve conduction and muscle function, to locate motor point before therapy electromyography testing, to produce muscle contraction case and partial denervation, to modulate pain through sensory nerve stimulation. So that is the purpose for checking the nerve stimulation on conduction on the skin or a different kind of patient. That is the purpose. Types of like stimulation. So diagnostic stimulation, therapeutic stimulation. Diagnostic stimulation in the physiotherapy is electromyography, which is EMG. Therapeutic stimulation is a muscle re-education for contraction of the muscle to if there any kind of like spinal cord injury and muscle like muscle weakness or muscle dystrophy. So muscle is forget about the contraction. So you can check the apply the Faraday current for muscle re-education or nerve stimulation. Psychological basis: low intensity stimulation, sensory nerve activation, pain relief. High intensity stimulation for nerve activation and muscle contraction. It means you can apply the nerve stimulation for low intensity, it will be pain relief, and high intensity stimulation is to be motor nerve activation and muscle contraction only for that. What is the indication of therapeutic of the peripheral nerve stimulation? So peripheral nerve injuries: neuroplexia, autonomosis, muscle weakness and atrophy, post-stroke or spinal cord injuries of four muscles, muscle re-education, pain management, both acute and chronic, functional electrical stimulation application. So that is the indication where we can check the nerve stimulation is present or contraction will be present or not. Contraindication is what? Over the pacemaker, cardiac devices you cannot use. Over the carotid sinus or anterior the neck you can never apply. To area of impaired sensation you can never apply. On this infection skin you also contraindicated. Over the broken skin or broken bone or open wound you can never ever apply. Pregnancy or malignancy in the cancer cell you can never ever it is a contraindication. So that is the case you can apply over the patient for checking the nerve stimulation and contraction if it is present or not. You can like write it down in university examination or practical of electrotherapy, which is a good marks you can achieve in